talking a little bit about wheezing now. So coming to wheezing, you would have heard your doctor say that the child is wheezing. So wheezing is very common, but the thing is, why is the child wheezing and what happens in the wheeze is what we are going to talk about a little bit. So these are normal lung tubes. So this is how the normal lung tube looks, and this is the tube from where the air goes in and out. Now what happens to the lung tube when the child is wheezing? This is what happens to the lung tube. So now you see compared to the normalcy that the lung tubes have become constricted or small. So the air entry into the same lung tubes is now more difficult. So, and there is also some redness and phlegm accumulation. Now this is what happens when the baby wheezes. That's why the air is not able to go into the lung tubes properly. So that leads to breathlessness in these children sometimes and the difficulty in breathing. So now how do we treat this wheeze and what are the causes? So the most important thing is the causes. In smaller children, most common cause could be viral. But if the child is wheezing recurrently, we cannot think that it is only viral. It could be something else underlying which is triggering the wheeze. So again, simple viral also can keep triggering in some children, what we say as transient wheezes. But some children have, along with wheezing, vomitings, poor weight gain. Now for these kind of children, we have to see whether there is anything called reflux. Some children who wheeze frequently also happens in cardiac. If there is any cardiac issue also, they keep wheezing. So we have to rule out cardiac issues. Coming to older children, again viral could be the cause, but if the wheezing is recurrent, then we have to look into whether the child is prone to any underlying allergies, or whether the child has anything called reactive airways, which is called sensitive airways, or whether the child is asthmatic. So this, depending on the cause, the child should be evaluated. So that will help in prevention of recurrent wheezing. So just treating the wheeze is always important in fact, but also looking at whether this child requires something else or evaluation for this wheezing is the most important thing. So trying to find out whenever necessary the causes for the recurrent wheezing and treating the actual cause helps in prevention of the wheeze rather than just treating the wheeze always.